These are the jokes, that's the things that they are still programming. This guy's more like actually
Bueno, yo voy a dar una no como algo que se queda solamente en San Francisco y en Estados Unidos, el tema del aborto con mucha fuerza aquí en Estados Unidos, pero se expande a todo el mundo. También por la noche, pues este crimen no es un año más bien la esperanza se extienda. Entonces quiero reconocer esta lucha que se hace aquí en San Francisco, porque si aquí en San Francisco, que es la falta de violencia, ¿no? Como le dicen, y hasta nos lo hacen saber, la importancia de mantenernos firmes en esta lucha recae no solamente como personas, sino como seres humanos. Entonces, pues nada, nos vemos en la marcha por la vida en California en Sacramento.
I don't think West Virginia's ready for what's about to happen next.
We cannot properly discuss whether or not abortion should be a crime or a right without discussing what is an abortion? What is happening in this instance? So, that is what this segment's going to be about. There are some images in this that are a little bit rough, because certain groups put out certain images that are a little bit rough. I'm not going to talk about efficacy or accuracy. I'm just going to say that that's what that is. But without further ado, we're going to jump right into it. First off, what is a medical abortion? A medical abortion involves taking pills that terminate a pregnancy. You'll most likely take mifepristone followed by another medication called mifepristol, though some people will only take mifepristol. We'll talk about that a little more in a second. A surgical abortion is when you remove the baby via surgery, the fetus via surgery. And this is all from Helpline, I will say. And I say because of what they're about to say, and this is partly just we'll call it journalistic ethics. Talking about exactly what sort of nonsense our sources are spewing. So, prioritize your privacy. There are legal risks to self-managed at-home There are legal risks to self-managed at-home medication abortions. Some states restrict access to telehealth abortions or receiving abortion pills by mail. This means discretion and privacy are absolutely paramount. If at all possible, tell as few people as you deem necessary about your pregnancy and your decision to terminate the pregnancy. Clear any immediate search, private message, or phone call history that might connect this to you. Hey, Helpline, why are we encouraging people to commit crimes and telling them how to get away with it? I don't care if you think abortion's a right or not, that's illegal. And that's fucked up. In-clinic abortional procedures. A procedural abortion, formerly known as a surgical abortion, is performed by a trained medical professional in a clinical setting, like an abortion or clinic, or sometimes a hospital. I don't know why I'm talking like this. I think if they just really... I'm sorry. On a public website, encouraging people to break the law is insane. Vacuum aspiration. It's the most common type of clinical abortion. We'll get more into that later. Here's what Healthline has to say about it. And then here's what Healthline has to say about a D&E. Again, we're going to actually do a full review of this in a minute. Watch out for crisis pregnancy centers. I already know what this one says. While some CPCs offer limited healthcare services like pregnancy tests or ultrasounds, they do not provide abortions or support accessing abortions. Okay. CPC workers are known to shame and mislead people into believing that abortion is unsafe or harmful. We're going to circle back around to that. Obviously, before I record a segment, I research the segment. We're going to circle back around to that. I just want you to remember that Helpline is the first group in this segment that said abortions are Helpline is the first group in the segment that said abortions are not unsafe or harmful. So according to Helpline, abortions are not unsafe or harmful. Just remember that. The Crisis Pregnancy Center map can help you steer clear of these predatory groups. What sort of language are you using? Like, this is actually insane. This is they think they're on the Underground Railroad. Whether or not it should be a right or a crime, this is actually insane. Less so illegal than the last little yellow page that they popped up. But this is actually insane and kind of disgusting to be saying to pregnant women who might be wanting an abortion, who are just coming on your website to get information. This is how you're presenting that to them. This is how you're having that conversation with them, as you're acting as if there's groups out there that are gonna hunt them down. I haven't even decided if I think it's a right or a crime yet, but I think that's crazy. What the fuck? Seek care. If you think you're experiencing complications, you just said it was perfectly safe. How could there be complications, Helpline? I'm already mad. This segment just started and I'm already yelling. But what the fuck? What is this? Healthcare professionals can't distinguish a medication abortion from an unintentional miscarriage. Actually, they can. And you don't have to disclose that you induced the abortion using pills. If something goes wrong and you have to go to the hospital, please tell them you took abortion pills. Just like if you take a drug and something goes wrong and you go to the hospital, tell them you took the drug. You might get into a little bit of trouble, but it will probably save your life because they need to know what's going on chemically. Helpline just straight up lied to you. This is actually going to get somebody killed. What the fuck? What is wrong with you? Good, we're done with that article. I fucking can't. What the fuck? We're 5 minutes into this segment. Anywho, let's talk about Planned Parenthood's video on abortion. And this is about what happens. We're going to talk about in-clinic abortions, and then we're going to talk about the pills. So what happens during an in-clinic abortion? I will say, and we're going to just sort of go through, but here's the picture of the tools. However, they do not specifically name the tools, which I thought was a little odd. Sometimes both suction and medical tools are used as part of an in-clinic abortion and evacuation or a D&E abortion. They say they're very safe and effective way to end your pregnancy. Effective? Yes. Safe? We'll talk about that. Medical tools may be put into the uterus as well as depending on how long you've been pregnant. That just depends on the type of abortion that you're having. The only time that it doesn't happen is if it's pills. So yeah. During a D&E abortion, this is how Planned Parenthood defines it. The doctor or nurse will examine your uterus, put in a speculum to see into your vagina. Oh, and I will say they have the video and then they have the page, so these are separate. So in the video, they don't list anything about what tools are being used, but in the actual page, they do. So just making sure I'm not going to get fussed at. There is a difference of what I was talking about. And we are going to circle back around to the video. But anyways, during a D&E abortion, the doctor or nurse will examine your uterus, put a speculum in to see your vagina, inject a numbing medication into or near your cervix, open your cervix a bit with either medicine or thin rods called dilators, insert a thin tube into your cervix or uterus, and use a combination of medical tools to remove the pregnancy tissue out of your uterus. During an abortion procedure, the doctor or nurse will examine your uterus, put a speculum in to see your vagina, give you a numbing shot in or near your cervix, open your cervix a bit if needed, And then they're going to insert a thin tube through your cervix into your uterus using a small handheld device that removes pregnancy tissue out of your uterus. Possibly use a small surgical tool called a curette to remove any tissue that's left behind. We'll talk about what that tissue is specifically in a minute. Or to check and make sure your uterus is totally empty. Once your abortion is over, you'll hang out in the recovery area until you feel better and are ready to leave. And so, you know how they mentioned a few seconds ago that it was effective? For instance, if the abortion does not end your pregnancy, obviously nothing is 100% effective 100% of the time. I just think it's funny. An incomplete abortion means some of the pregnancy tissue is left inside of your uterus. Risk of injury. Again, I thought it was perfectly safe, Planned Parenthood. There are also small risks of injury from the medical tools used during the abortion. What exactly are those medical tools? Because again, we have gone back to the video. This is from the video. There is no mention of the medical tools in the video. You'd have to go read the article. So, what exactly are the medical tools? Who knows? You can exercise and have sex as soon as you feel ready. There's no timetable to this. Remember, you can get pregnant again within 2 weeks of the procedure. It's totally normal to feel a wide range of emotions. According to Planned Parenthood, everyone feels different after their abortion. And so just a quick review of the Planned Parenthood article before we jump into the other two sources. So they don't tell you what the implements are. It mentions that lab tests and ultrasounds are going to be needed to determine the age of the fetus, which is for some reason important. They don't tell you why, but they just say it might be. Dilation may be necessary to perform abortion. Again, they don't tell you why. And we're going to circle back around to that in a minute. No mention that abortion involves a fetus or real details of the procedure. They just call it pregnancy tissue, which, again, if it should be or shouldn't be, we haven't really discussed yet. However, could we not play oratory games? It's not pregnancy tissue. It is, in fact, a fetus. It is a fertilized egg. It's an embryo. It isn't pregnancy tissue. Cool. Notes that an abortion may have risks and may not end a pregnancy, but only at the end, and tells you at the beginning that it might be fine. Fetuses are called pregnancy tissue. Again, I really don't like that. Heavy bleeding is normal for a few days, and spotty and delight bleeding is very common, according to them. And of course, they just say go ahead and have a quick return back to physical activity and sex, and then pregnancy occur within 2 weeks of an abortion. Cool. Love that for literally nobody. So next up, we have how Students for Life and Live Action talk about abortions. And these are, this segment is a combination of their two videos. They were basically identical, not linguistically, obviously. They had different people talking. And we're going to actually cover and talk about because they actually tell you who's informing you about how abortions work in their videos. So we're going to talk about these people at the very end, who these guys are. But since they're both giving you a direct play-by-play of these abortions, they're very similar. So I just sort of merged them together to add some extra information all in all and make sure I hit all the bases and how I'm talking about these, since they actually gave me a ton of information as to how an abortion works. So a first semester surgical abortion, suction, aspiration, also known as a D&C. So this is performed at 5 to 13 weeks, and it's the most frequent form of abortion. And so firstly, they'll insert what's called a speculum. This is what a speculum looks like. And then this is used to force open the vagina. And then they're going to use, which that's what that looks like. And then they're going to use dilators. These are dilators. And then they take these dilators and they slowly go up in size, and they will insert them into your cervix to widen the cervix. We're going to talk about a little bit more about that for the D and E, but for the D and C, this is how they defined it was working. I do believe Live Action did mention Lamaria for this, but I'll explain what that is momentarily. But Lamaria may also be used for this part of the procedure. And then a suction cannula, that's what that looks like, is inserted into the womb, into the vagina, past the cervix, into the uterus, into the womb, and is used to dismember and remove the fetus, the fetal tissue from the womb. And here are 2 stills from that video, and how they show that, like I said, graphic. Yeah. An incomplete abortion is when part of the fetus does not successfully get sucked out like that. And of course, the fetal tissue is weak and is able to rip apart and be sucked into this suction cannula. Granted, at 5 to 13 weeks, it does look a little bit like a human. We talked about this in the biology section, where at this point it isn't just like, I don't know, it is, especially more towards the 13-week point, it looks like a little mini person a little bit, you know? Just saying. And so if an incomplete abortion occurs, they will insert a curette, and this is a curette. They'll insert it and use it to scrape out any tissue left behind from the placenta or the fetus until it's empty. Because if it's left behind, it could cause sepsis or another, well, sepsis is the only type of internal infection, but it could cause septic infection, it could cause bleeding, all sorts of issues that are just not fun. And then this is what a curette actually looks like. So the risks and adverse effects of this form of abortion: uterine perforation, cervical lacerations, there's risk of infection, and then just maternal death may occur, hemorrhage may occur, and then there could be future pregnancy complications. Which, I mean, they don't talk about how likely these things are to occur, which is the one thing I will say. So yeah, I don't know. So then at 13 to 24 weeks, we have what is called a D&E abortion. These are actual pictures of fetuses at 13 to 24 weeks. Yeah. So a weighted speculum is inserted to open the vagina because it needs to be wider, because the fetus is bigger. And then Lamaria, I mentioned I was going to circle back around to that. This is a sterile seaweed that actually dries out the cervix, and it's put in 24 to 48 hours in advance of a D&E abortion. Once the Lamaria is in, then they're going to use dilators to open up the cervix, just like they do with a D&C. And then they're going to insert the suction cannula to remove the fluid from the womb, from the uterus, whatever word you want to use. They're going to use a suction cannula to suck up the fluid. However, with a D&E, the fetus is too large to fit into a suction cannula and be dismembered by suction itself. Cool. So, in order to remove the fetus, once the fluid is removed, Sofer clamps are used, and these are what Sofer clamps look like. It should be noted that in both videos, it is demonstrated exactly why Sofer clamps are useful, and that is because the teeth, or I should say the head of the clamp, has teeth that are serrated, that are designed to grab and tear flesh and tissue, which is exactly what they're used for. These Sofer clamps are used to dismember and remove the fetus. They're obviously, like I said, serrated, and this is because the fetus is too large to fit through the tube and be dismembered by the tube. So they have to stick the clamps in to rip the fetus apart and remove it piece by piece. One feature of this that should be noted is that the head is the largest part of the fetus at this point and does not fit through the cervix. Even with dilators, it just doesn't fit. And so it has to be crushed. And they know the fetus's head has been successfully crushed when white fluid begins draining from the cervix. That white fluid is brain tissue from the fetus. At that point, the skull has been broken and can be removed. Once all the fetal tissue is removed, the abortionist will pause, reassemble the fetus, and then if there are missing parts, go back in with a curette and remove anything left over. Risks and adverse effects of this abortion procedure. Uterine perforation, cervical laceration, infection, hemorrhage, maternal death, and future pregnancy complications. Now, third trimester abortion induction, also known as an induced stillbirth. There's discourse on whether or not this happens. Fun fact: if there is no ban against it, it happens. It's been admitted to multiple times. There's all sorts of information revolved around that. There's a lot of people who will tell you it doesn't. It does. A lot of these groups that, fight against this stuff, I will say, I was looking at it, they will call abortion clinics and say, hey, do you do this? And they go, hey, we do in fact do this. And they go, cool, thank you. And then they'll hang up the phone. And then they'll look at whatever dum-dum told them they didn't do it and go, did reality just lie to all of us? So this does happen. And if you want to disagree with me, you're wrong and you can argue with the wall. And we're going to talk about what it is. So, a third trimester abortion, or induction of stillbirth, is performed at 25 or greater weeks. And this is because it is a fully developed fetus at this point, pretty much, and it can survive outside the womb. So, it takes 3 to 4 days to perform this procedure. Day 1, digoxin injections. Digoxin is basically a heart medication that when it is overdosed into a fetus, kills it. That is how it's described in these videos, okay? Don't come for me for the language. That is how it's described. So, and the digoxin is it's inserted through the mother's stomach into the fetus, and it either goes into the head or the chest, specifically aiming for the heart, and they use ultrasound to guide the process. Digoxin is generally used to treat heart problems, like I said, but in high enough doses can be fatal to the fetus. And here is a picture of how that it's a little bit animated, obviously, but they use an ultrasound, and that is a fetus at 25 weeks. They use an ultrasound, and then they'll guide in the needle. This is basically what it would look like, but a little bit animated and goofy. But yeah. After that point, the mother is sent home. She is given mifepristone on day 1. Lamaria is then placed after the digoxin is injected. And the mother is going to carry this dead fetus for 2 to 3 days. Okay? Mifepristol is then administered, and this induces stillbirth. And this can happen at home or at a clinic, just like with the abortion pill, which we'll get into in 1 second. If the entire fetus is not retrieved, a D&E is then performed. So sometimes, for some reason I can't tell you why, the whole fetus doesn't come out. And so they have to go in and perform a D&E. What? The mother walks around with a dead fetus in her womb for 2 to 3 days. Because the lomaria has to dry out the cervix so then it can be dilated and the fetus can be removed. And the mifepristol, the abortion pill regimen, is designed to induce pregnancy because induce labor and the pushing of the fetus. Basically, they kill the fetus and then force you to give birth to a dead fetus. That's how this works. Let's talk about the people who brought us this information. Did I tell you the side effects actually first? Incomplete abortion, cervical laceration, infection, hemorrhage, uterine rupture, maternal death, and future pregnancy complications. So this is Dr. Anthony Levatino. He is an OBGYN and has performed over 1,200 abortions and is now pro-life and works to help educate individuals about what an abortion is and speaks advocacy out against them. This is Dr. Kathy Altman. She's also an OBGYN, performed over 500 abortions, and is now pro-life, and just like the gentleman, works to educate people on how abortions work and attempts to stop them. This is Dr. Beverly McMillan. She is also an OBGYN, and performed over 500 plus abortions, and interestingly, she helped found one of the first abortion clinics in Mississippi. She is also now pro-life and attempts to help educate people on the issue of abortion and get it restricted. And then this is Dr. Patty Gibink, also an OBGYN, and performed over 1,000 abortions, and just like the others, is pro-life and working to end abortion. So, next up we have the abortion pill. Now, I did this backwards, one, because of a brain flu, but also because I researched it backwards. But there was actually a little bit more method to my madness, and that's because this sort of leads us into the final section, and so that's why. But this does happen earlier. So, according to Planned Parenthood, abortion pill is the most common name for using two different medications to end a pregnancy, misoprostol and misoprostol. You can use misoprostol alone and also have an abortion. And then here is a picture of both of them. Mifeprex is just a brand name. First, you take the pill called mifepristone. Pregnancy is needs a hormone called progesterone to grow the fetus, and basically mifepristone goes in, blocks progesterone, and it just stops your body from producing it. It should be noted that Planned Parenthood doesn't tell you this. However, Live Action and Students for Life do. Planned Parenthood doesn't. I feel like that should be noted. I don't know why they don't, but they don't. A injection of progesterone can reverse the effects of mifepristone. So if you are a woman who gets an abortion, takes the mifepristone pill, and then regrets it, you can, and the quicker you get this, the better, you can go very quickly and get an injection of progesterone, and it has a chance of saving the fetus. If you do not, the mifepristone will stop the supply of progesterone to the uterus, which will cut off the supplies of oxygen and nutrients to the fetus, killing it. What is mifepristone? Brand names include Mifeprex or Corlium. There we go. And it's an oral tablet. Drug class: progesterone receptor modulators, urotonic agents. I don't even know. And this is a picture of the nice little drug. And then you're going to take the second medicine, mifepristol, either right away or up to 48 hours later. And this medicine is going to cause cramping or bleeding to empty your uterus. It's kind of like having a really heavy period, according to Planned Parenthood. They also refer to it as similar to a miscarriage. That's because it is the exact same as a miscarriage. It is an induced miscarriage. You kill the fetus, and then, so the mifepristone kills the fetus, the misoprostol forces it out of your body. That is a chemically induced miscarriage, essentially. If you don't have any bleeding within 24 hours of taking mifepristol, something is very wrong. And so this can happen if you're at home, if you're at the clinic. It can happen anywhere. It can happen while you're shopping for groceries. Once you take that pill, at any point you can go into this induced miscarriage state. And so a lot of a lot of women who choose this choice of abortion will spend most of the day in bed or sitting on the toilet. I am at a loss for words. That is horrifyingly boring and just awful. Misoprostol, brand name, it could be Cytotec, and it's an oral tablet, and it's a miscellaneous GI agent. Whatever. And here's a picture of the drug. Sorry, I just bumped the desk. At 8 weeks pregnant or less, the abortion pill regimen works 94 to 98% of the time. At 8 to 9 weeks pregnant, it works 94 to 96% of the time. At 9 to 10 weeks pregnant, it works 91 to 93% of the time. If you take an extra dose of mifepristol, it's going to work 99% of the time, because of course. And then at 10 to 11 weeks pregnant, it works about 87% of the time. If you take an extra dose of mifepristol, it works about 98% of the time. So at any given moment of this stage, there is at least a 1% chance you will not have an abortion successfully. Since the FDA approved the abortion pill, 4 million preborn children have died or been aborted I am reading from live action. I apologize. So the language is going to be a little bit more like dun, dun, dun. Whereas that is one thing I've noticed. Total tangent real quick. Pro-life groups. The language is very blunt. I wouldn't say it's like, okay, it can be kind of alarmist and a little bit just like, however, I have noticed that these pro-life groups, specifically Planned Parenthood, omits a lot of information that should probably be shared with people and is very just like laissez-dactycal about the whole thing. It's all very puppy kisses and rainbows and unicorn kisses. Like, I don't understand. One's just over here acting like it's doomsday, and the other's over here acting like everything's absolutely perfectly fucking normal. And I will have to say, at this point of my studies and everything I've looked at, I feel like the pro-life argument's giving a more realistic example of what's happening here. Why that is slightly beyond me. Do we think people won't support the matter if they know what's going on? If people won't support your position if they actually know what's going on, you have a bad position. Just saying. Just saying. The FTC has received over 4,000 reports of adverse effects from women experiencing hemorrhage, excruciating abdominal pain, and severe life-threatening infections, yet abortion manufacturers have only been required to report adverse events as reported in the abortion facilities. Just read it. I'm over this. I'm over this. All right. Leads us into our next thing. And that is the fact. I can't believe I'm about to say this. The disposal of fetal tissue is a contested point. The disposal of fetal tissue is a contested point. I just meant it. That is bad. Why? What the fuck? Why? Why? Why, Sean? Margaret? Cynthia? Everybody? James? You want to tell us why this is a thing, James? Like, what the fuck is happening? Why is the disposal of fetal tissue a contested point? That don't make no sense. But here we are. So the first contested point is the fact that it's actually harming the environment, specifically when it involves the abortion pill. Why? Because even in abortion clinics, the common way of disposing of the fetus after an abortion pill is administered is flushing it down the toilet. Or washing it down the sink. Those are the two ways you dispose of a fetus via the abortion pill usage. Why is this considered contested? Because at the age of which at the fetal age at which you take the abortion pill, a formed fetus can be identified. It has surpassed a clump of cells state. It's never really that, but it has surpassed a state where it isn't like really being able to be told what it is, into a state where it is visibly a fetus, it is visibly an organism. You can have the abortion pill and actually see a fetus in the sac. And that just gets flushed down the toilet. And that is the standard practice. So this is a brief from Students for Life. And they're talking about how the Endangered Species Act requires certain restrictions on chemicals being produced into the water via waste and stuff. Their argument is basically that, one, there's just fetal waste in the sewer system. Two, because of that, and because of the way that these drugs affect the uterine lining, that there is mifepristol or mifepristone in the water, and that water treatment plants do not properly decontaminate these chemicals from the water. If true, that's very alarming, because that would be forcing people to have an abortion, potentially, without their consent, because the chemicals are right there in the water and they could be consuming it. Not to mention, what could those chemicals potentially do to men? Because at the very least, they affect hormone producage. Female hormones, which are present in different levels in men. Food for thought. So they want the same kind of standards for medical waste disposal for abortions as other medical waste, because like I said, a lot of the time disposes is just washing it down the sink or flushing it down the toilet. And this does also apply to other sections, which we'll get into in a minute. In doctor's office, clinics, and hospitals, medical waste of all types is collected in red and yellow bags and containers for medical waste disposal of properly. These bags containers are also sometimes used in a home setting for placenta from at-home births, for miscarriages, and to collect kidney stones, among other reasons, but not abortion for some reason. So this is from an article criticizing it right off the bat. Right off the bat, the first thing that jumped out to me is that at the beginning, they mentioned that they have only... This article mentions that Student for Life only has one source. Then throughout this article, they go to talk about multiple different sources that Students for Life had. Make that make sense. It doesn't, but whatever. Pop up, I guess. So on April 19th, Students for Life filed a citizen's petition imploring the FDA to conduct an environmental study, arguing that it hasn't been done in over 20 years when it comes to abortion pills. Y'all can just read the rest. Students for Life. Okay, here's the part that really what the fuck are you talking about? Cited one scientific paper. This article will go on to discuss more than one paper that they talk about. And its petition that identified at least 3 active metabolites or byproducts in mifepristone that can remain active after passing through a person's system. But this is typical of many pharmaceuticals and is not a sign that the drug is harmful. Yeah, but there are some pharmaceuticals that it is harmful. This, I don't know. I find really shitty reporting really offensive. It's certainly not uncommon for substances to maintain some... literally, what the fuck? Not a sign that it's harmful, but it is common for them to maintain some level of activity. FDA is required under the National Environmental Policy Act of 1969 to consider the environmental impacts of approving new drugs and biologists as part of its regulatory process. True! That's what they're asking them to do! 1996, and said it predicted environmental concern was less than 1 part per billion, the threshold under which concentrations are routinely found to have no effect on tests of organisms. Okay, then if that's the case, rerun the test. It should come back the exact same. I'm not understanding this uproar about it. Just rerun the test. Shitty reporting. One 2018 study of a Chesnokian cited the petition is most likely about progesterones, a hormone that helps maintain pregnancy. Lead author Pavel Sorer, a researcher at the University of South Bohemia's Faculty of Fisheries and Protection of Waters, said the group using his report as evidence of the drug's environmental harm on animals or aquatic life is a misrepresentation. He said that the team only tested for the occurrence of mifepristone in wastewater or surface waters. He said these tests cannot assess how it affects marine life. Basically what this dude's saying is, they didn't... Okay, so misrepresentation is a misrepresentation, in my opinion, because they're basically saying, yeah, we determined it's in the water, but we didn't study how it affects anything, so you can't say that it could affect something. No, that's not how that works. Groups, researchers are allowed to take your conclusions and use them to draw their own conclusions. And that's by no means a misrepresentation. I'm not even sure, there's very little collaboration on whether or not he said this. This is the only spot I found that. Yeah. So, I don't know. I think if it's not a big deal, just rerun the tests. If it's not happening, just do it. No problem. Just go do it. Just go do it. No? Okay. I have seen information on this before. Everything I've seen actually isn't really worried about aquatic life and the environment. I mean, there is mentions of environmental concerns, but then they jump to the concern of, is it in our drinking water? Is it affecting us as a wider society? And why don't we know that? I also cannot stand an article that contradicts itself, like that one. So just on that alone, and that's really the only article I found really trying to talk about what Students for Life was saying, which is also a little odd. But in that article, they're contradicting themselves. So, I don't know. Because of that, I'm way more inclined to believe Students for Life, because you can't write a good article. In most cases, the remains of aborted fetuses are treated as medical waste and disposed of accordingly. This typically involves incineration or a process known as autoclaving. Autoclaving involves subjecting the fetus remains to high-pressure steam, effectively sterilizing them before disposal. This is from an article talking about fetal disposal, because that is our next topic. Here's more on both of those. Pause to read. Cool. Strict regulations to ensure the proper handling and respect of human life. Are you sure? Summary of findings, and this is from a study studying whether or not these regulations are followed, and also just discussing whether or not there are concerns around there are like adequate concerns around the disposal of fetal tissue from abortions. Violations and problems with fetal disposition laws have been discovered in numerous states, including Indiana, Michigan, Pennsylvania, South Carolina, Texas, and Utah. Examples of documented violations of state law by abortion facilities or waste disposal companies regarding fetal deposition includes failure to disinfect containers and sending body parts down the sanitary sewer, disposal of fetal remains in municipal solid waste landfill, and storage in a refrigerator. Basically what this is saying is they're not cleaning it, they're washing it down the sink, or they're just throwing it in the fridge. Or all of the above. Due to the variety and archaic status of some state laws, numerous fetal methods have been employed as legal solutions by abortion facilities and waste disposal companies, including flushing fetal body parts through the garbage disposal, leading to the sewer system, dumping fetal remains into an auger along with medical waste, and then grinding them together and having the fetal remains transported across state lines into another state's dumpsters. What the fuck? I'm not even going to read the last one. I don't have the stomach for it. Okay, so this is a quote from a comment underneath a live action video that kind of, I feel like, sums up everything I just read. I'm going to read it to you. And I just stood there thinking, all those babies are in Dr. Moy's sewer system. And the Des Moines says, and I just stood there thinking, all those babies are in the Des Moines sewer system, which means people are drinking and bathing in reprocessed filtered water that might have the blood of dead children. This is the stuff of nightmares. Oh my Jesus, forgive our sins, save us from the fires of hell, lead all souls to heaven, especially those in most need of the mercy, or of thy mercy, sorry. While it is a little bit of extreme, I think it quite sums up the reaction that can be made from a direct conclusion of the point that the Des Moines source system has fetal tissue in it. A lot of it. Since they're just grinding them up and washing them down the drain. What the fuck? What the fuck? And so, Live Action actually did interviews with several ex-abortion workers. I'm going to put quotes up from that here. I'm not going to sit here and read each of them to you. Essentially, they just confirm everything that was said. And it's disgusting. It's disgusting. It's foul. What? Like, they talk about how abortionists with glee reassemble the fetuses. How they're just flushed down toilets, or kept in formaldehyde jars, or put in fridges. How there's very little training, and these are all Planned Parenthood workers, I will say. How they did not undergo a lot of training. How they just walked in and started working in these settings and environments and expected to handle these things. How there were rooms literally filled with jars of dead fetuses. All stuff that they're talking about in these interviews. And that how in the disposal, which is the part we're really focusing on here, it's just washed down the sink. There is no proper handling. There is no anything. It's washed down the sink or flushed down the toilet. It's sent into the sewer system to be handled by the municipal water industries. So yeah. Finally, what we need to discuss when it comes to abortion is the claim that some people survive abortions. And a lot of people don't like that claim. They say it doesn't happen. They say abortions are successful 100% of the time. They're not. Planned Parenthood even admits they're not. Come on, guys. Let's not get that ridiculous. But anyways, so first and foremost, we have an act that basically requires you to intervene if a baby survives an abortion. Because there was a legitimate issue from whistleblowers from within Planned Parenthood of essentially a stance when it comes to that. Of course, people were saying it didn't happen, and then eyewitnesses came forward and said it did. This feels like a lot of something that happens a lot in the abortion argument. Pro-life sides will put forward a juxtaposition. Pro-choice will say it didn't happen. Eyewitnesses come forward. Pro-choice tries to denounce the eyewitnesses. It's juvenile. Here's more from that bill. You can pause to read if you want. A lot of people are saying, why is this needed? It's not a thing that's happening. Well, if it's not a thing that's happening, it doesn't matter if it gets passed or not. Like, if it's not gonna affect nothing, why does it matter if it's passed? You might, like, just let it be passed. Just let it be passed. If it's not gonna stop you from not intervening with babies, why does it matter to you? It's one of those, like, laws that I'm just like, okay, it doesn't happen, so just let it be passed. Like, it's not, if it doesn't happen, it doesn't affect anything, just let it be passed. Like, I don't, it's just like the argument with the Students for Life trying to get the FDA to retest the water. If there's nothing in the water, let them test the water. They're gonna find, like, I don't. So yeah, here's explanation, and it's just saying that it's gonna require you to help a child if it's born alive from an abortion. And this is way more specifically talking about the third trimester abortions, where you inject drugs into the baby's brain to it. And obviously it's also making it illegal to intentionally just kill a fetus for surviving an abortion. I hate it here. In 2002, Borderline Infants Protection Act easily passed through Congress, so Congress was more than happy to pass it, even though people continued saying it wasn't necessary, it wasn't happening. If it's not a problem, why does it matter if it's a bill? And here's just another excerpt from the article. The bill basically is aimed at, like I said, these like situations where you just walk away. You just walk away. This is what Planned Parenthood has to say about the matter. The group accused of doing this the most often. The American Medical Association strongly condemns any interference by the government or other third parties that causes a physician to compromise his or her medical judgment as to what information or treatment is the best interest of the patient. So then what's the issue with being told to save the baby? This is the Born Alive Act. If a fetus comes out from an abortion alive, it's requiring you to save it. And yeah, sure, there might be a little bit more nuance to it than that. Nothing. What? Deceptive. So-called Born Alive bills are anti-abortion tactics that make up a problem that doesn't exist. Doctors already have an obligation to provide appropriate medical care. Then what does it matter? Voters in Montana rejected a ballot referendum about a similar efforts in November. Good for them. What? House members acknowledge that this will not pass in the Senate, and no, anti-abortion legislation is unpopular with the American people. If you remember my beginning segment from Ballotpedia, a group that studies the ballot, anti-abortion, pro-life stances are actually what's more popular in the U.S. right now, not pro-abortion, not pro-choice. The more I do of this, just even without deciding whether or not this should be a right or a crime, Planned Parenthood pisses me off. Irregardless if abortion is okay or not okay, Planned Parenthood pisses me off. It is a misrepresentation of so much shit. This is from, I want to say Students for Life. No human deserves to be suffocated, strangled, or abandoned, especially defenseless babies. All babies born alive after failed abortions deserve to be treated as patients and should receive any medical treatment needed to survive. Only 18 states have legal protections in place for babies who survive abortion. The U.S. must enact robust federal laws to ensure the safety of all abortion survivors, not just those born in specific states. Again, if it's not an issue, what would it matter if there's a federal bill requiring all babies who survive an abortion to be helped? If it doesn't happen, or if they're already helped anyways, what would it change? And just to like sort of drive home that it does happen, this young lady, I say young lady, is Melissa Oden. She's a abortion survivor and founder of the Abortion Survivors Network. She has survived and attempted saline abortion in 1977. She uses her story of survival to help bring attention to the fact that babies do survive this. And so, you know, she helps people who do survive this also come together, find peace, creates these support groups, and works very hard to help defend the right for a child to be allowed to live through surviving an abortion attempt. Like, if it's not happening, why is it an issue? This is Queensland statistics, so you can be mad at me if you want for using Queensland in an American discussion, but pop off, I guess, because it's even noted in the article that it is sort of indicative of a first worldwide thing. Not third, but first world. This is kind of how this has been going, and this is hinted to, and I just have numbers that kind of show it. So a steady rise in abortion survivors. You can see the numbers there, obviously. And so from 2005 to 2015, 204 total survivors, with an increase of 19 survivors from 2005. So 2005 we had 8, 2015 we had 7. That's an increase of 19 survivors, with that number starting at like 8 survivors and slowly increasing from there. You can see the numbers. You can see what I'm talking about. It happens, and it's happening more frequently. I do want to close this section by talking about the impacts of an abortion. Here is a graphic talking about how abortion can affect a woman's mental health. Increased mental health risk of abortion. Anxiety disorders at 34%, depression at 37%, alcohol use/abuse increases by 110% after abortions. Suicidal behaviors increase by 115%, and marijuana use/abuse increases by 220%. New studies have shown that women who have abortions are 81% more likely to experience subsequent mental health problems, suicide, regret, substance abuse, a sense of loneliness or isolation, a loss of self-confidence, insomnia or nightmares, relationship issues, and depression. Abortion heightens the risk of mental health issues, with studies showing women are 34% more likely to develop anxiety, 37% more likely, we just covered all this, but to develop depression, so on and so forth. Risks of if the abortion goes as planned involve heavy or persistent bleeding, damage to the cervix, abdominal pain or cramping, scarring of the uterine lining, breast cancer due to hormone imbalances, future premature births or miscarriages due to damage to the uterus and hormone imbalances, risks of things going awry, infections or sepsis, placenta previa, which is extreme damage to the placenta, perforation of the uterus, damage to other organs, and death can even occur due to complications from abortions. This young lady who's on the screen, her name is Tonya Reeves. And in July of 2012, she bled to death from a botched abortion at a Planned Parenthood in Chicago, Illinois. She is one of just a handful of cases like hers, or one of many cases like hers. Anyways, in 24 months, so in a 24-month period, 14 women had serious medical emergencies at Planned Parenthood locations in Virginia Beach, Houston, Texas, Birmingham, Alabama, and many other locations. Like I said, 14 women, all separate locations, all had medical emergencies. That's just 3 of the locations. Planned Parenthood, when you call and ask them about this, will not disclose this information. They will actually guarantee you that an abortion is safe. You can call, I'm going to tell you again, you can call Planned Parenthood and ask, is abortion safe? Has anybody died? They will not disclose this information, and they will tell you abortions are safe. And I'm not saying it's a high guarantee that an abortion is going to result in death. I'm saying there is a risk, and they don't disclose that. They act like everything is 100% hunky-dory and fine, and that there is no risk of anything going wrong, and that you will be perfectly happy after your abortion. Like earlier stated, they encourage sex as soon as you feel ready, with no guidelines, no time frame, no nothing. Here's what Planned Parenthood has to say after their abortion stuff. What happens after my abortion? This is from Planned Parenthood. Right after your abortion, you'll rest in a recovery room for up to around an hour. If you had any kind of sedation, you should have someone else help you get home safely. Plan on taking it easy for the rest of the day. You can go back to work, school, driving, exercise, and most other normal activities the next day if you feel up to it. You can have sex as soon as you feel ready. It's normal to have some bleeding after an abortion. You can use pads, tampons, menstrual cup, or whatever is most comfortable for you. But your nurse or doctor may recommend you use pads so you can track how much you're bleeding. You may have spotting for several weeks, and some people don't bleed at all. This is normal. Most people don't have any problems after their abortion, and recovery is usually quick and easy, but you call your doctor right away if you soak 2 maxi pads per hour for 2 hours, so 4 maxi pads in 2 hours. Have belly pain or cramps that don't get better with pain medication, or have a fever over 100.4 degrees Fahrenheit. Range of emotions is possible to experience. Studies show that most people feel relief, but sometimes people feel sad or regretful. Really? Because the most recent studies say the opposite. Many people feel all these things together. However you feel is totally normal. Everybody experiences different, but if your mood keeps you from doing things you usually do each day, call your doctor and nurse for help. You can also call Exhale or all options for free, confidential, and non-judgmental emotional support after an abortion. No matter how you're feeling, for spiritual support before, during, after an abortion, check Abortions Welcome. How soon can I have sex after my in-clinic abortion? As soon as you want. Yeah, cool. And that sums up a review of what is an abortion. Cool. Planned Parenthood pissing me the fuck off. We have one segment left. Well, technically 2, but 1 kind of. And that's history. History is going to be brief, and it's actually not going to be a published segment. Separate. It's going to be part of the finale segment, which is going to be history. History decision retorts. There we go. That's what I meant. So yeah. I'll see y'all there. Heyo, it is me from the future on my phone. I want to say that the argument that I'm making, that if it doesn't happen, just do it anyways, it's just me being a smartass. I do highlight my actual argument, but I want to reiterate that clearly because I didn't say it in clear, concise terms. My actual argument is not if it doesn't happen, do it anyways, because it does happen. For the chemicals in the water, my argument is if there is a chance of this happening, which studies say there are, we should probably test it. I'm being a smartass because they want to say it has a 0 chance of it happening. And so it's not the best look for me, I know, but that is what's going on there. And so since there's a chance, we should be testing for it. Do I actually think it's happening? And do I actually think that there's a 100% chance that it's affecting people? Yes, I think it could very well be happening. No, I don't think it's a 100% chance if it is happening, it's affecting people, but it could be affecting people. And that's what the science shows us. So we should be looking into it. As for the Born Alive Act and all that, we know what's happening from firsthand accounts and firsthand reports. I don't cover that in full, but I do mention it, and I do highlight other stuff related to some of this. And so we know people survive it. We know doctors do, unfortunately, don't save babies all the time. It's not 100% out. It's like a rare occurrence, yes. But, you know, murder isn't that... Well, actually, murder is sort of becoming really common. Anyways, it still is a thing that happens. We know babies are born alive. We do know sometimes abortionists don't save them. So passing the bill just makes sense. They're claiming it doesn't happen, so again, I'm being a smartass. Not the best look, but I do want to clarify my arguments on those. I figured that would be smart on my part to take the time to clarify, because I was watching it back in editing, and I was like, you know what, it's not clear. Like, I say it, but it's not clear, so I'm clarifying. Like I said, the final segment is going to be history, decision, retorts, and by retorts, I mean just response, because I opened the floor to you all on social media, and I will be responding after I make my decision to what you have to say on whether or not you're pro-choice or pro-life, and why that is. But yeah, I will see you all in the next segment, and I hope y'all have a great rest of your day. Go check it out, and I hope to see y'all there. Peace out, loves, and like I said, have a great rest of your day.